The dreaded Delta variant, first detected in India, is now a global worry with alarming spread, forcing the World Health Organization to tag it among 4 global variants of concern last month.
The other big story of concern, which is a variant of concern called the Delta Plus.
भारत में कोरोना के केस घट तो रहे हैं, लेकिन डेल्टा प्लस वेरिएंट से खतरा बढ़ता जा रहा है.
Many of you might remember the Delta variant as the double mutant variant. Found first in Maharashtra in October 2020, the WHO named this B.1.617.2 strain of the novel coronavirus as Delta. In the time since, it has not only spread to over 80 countries, but it has also mutated further. One such variant is called the Delta Plus. Are these variants more infectious? Are they more transmissible? Will vaccines work against them? We break it down. After being discovered in Maharashtra in India last year, the Delta variant was soon reported in multiple other states and also beyond the borders of the country. The United Kingdom has seen a rise in COVID-19 cases due to the Delta variant, forcing the country to delay the lifting of its lockdown to July 19, 2021. In both India and the UK, the Delta variant has become the most dominant strain of the virus. Public Health England officials and experts have attributed this sudden spike in Delta variant cases to the volume of travel. In the US, as per estimates of Dr. Anthony Fauci, infectious diseases expert and top scientist, as many as 20.6% of the COVID-19 cases in the country could be because of Delta variant as of June 23. Experts have called the Delta variant the fastest and fittest of the novel coronavirus, leading to the WHO listing it as a variant of concern.
This variant has demonstrated increased transmissibility. It is more transmissible than the Alpha variant, which is the B.1.1.7, which spread rapidly around the world. This Delta variant is spreading rapidly around the world as well.
India, which is recently witnessing a decrease in COVID-19 cases following a deadly second wave, is now bracing for another threat. The Delta Plus variant, or the AY.1, which was first identified in Europe. The first case of Delta Plus variant was found in India from a sample taken on April 5, 2021. As of June 24, 40 samples have been found to contain this mutation. These are from Kerala, Karnataka, Tamil Nadu, Maharashtra and Madhya Pradesh. The Delta Plus variant has been declared a variant of concern in India. And according to the Health Ministry, the Delta Plus variant has increased transmissibility, stronger binding to the receptors of lung cells, and potential reduction in monoclonal antibodies response. What differentiates the Delta Plus variant is that it has acquired a spike protein, K417N. Interestingly, this spike protein was first seen on the beta variant identified in South Africa. It reportedly gave the virus immune escape properties, meaning it would prevent the human immune system from identifying the pathogen if it enters the body.
This particular virus is exactly like Delta, except one more amino acid is different.
Okay.
One amino in a chain of amino acids. So, whether it make a difference or not, we don't know. Nobody knows. We have seen it. Now, if it is more infectious, then it can also start spreading faster than the Delta. Okay. However, if it is not, it's obeying the previous infections and listening to, heeding to the immunity we already have from previous infection, then it won't be able to reinfect those people. So the spread won't be as much because the number of people who are already infected is very large in India.
Globally, there have been at least 197 reported COVID-19 cases that have been traced back to the Delta Plus variant in a minimum of 11 countries, including the UK, Switzerland, the US, Nepal, Poland, Portugal, Japan, Russia, Canada, Turkey, and India. Will the Delta variants make you sicker, and will the vaccines work? A study by Public Health England, an executive agency under the UK's Department of Health, associated the Delta variant with a 64% increase in chance of household transmission. We must remember though that this is emerging evidence and more research is needed to establish the true implications and dangers of the Delta and Delta Plus variants. As per a recent PHE study, the Pfizer and AstraZeneca vaccines are 96% and 92% effective respectively against hospitalization from the Delta variant. So, while more research is needed to find out how differently these variants will affect humans, if at all, vaccines do provide a significant amount of protection. In fact, experts have reiterated time and again that it's very normal for viruses to mutate over time, and not every variant will be a cause for concern.
None of the variants become important unless you show a clinical correlation in terms of higher infectivity, higher mortality, or immune escapism. Any time there is a transcription error in the virus, it will be a new variant and it will keep happening. Okay, so but the evidence will be there will be unusually large number of reinfections. Now, one case doesn't make it happen. You need a series of cases where people are getting reinfected, and this will usually be noticed among the staff of the hospitals who are looking after COVID, because most of them have been infected in their earlier months.
We know that there's a recent suggestion from one study in Scotland suggesting that there's an increased risk of hospitalization, but that is some preliminary work. We don't have an indication of increase in mortality from the Delta variant, but again, we're still studying this variant as it's circulating around the world. We do know that all of the variants of concern, including the Delta variant, the vaccines remain effective against severe disease and death, and so this is a very good sign, but we need 2 doses to be administered to have the full level of protection.
Dr. Mulyal also explained that if the Delta variants are found to be conclusively more infectious, then the herd immunity threshold for the pandemic to not be a threat anymore will also increase. Meanwhile, there are several measures that need to be taken.
It doesn't mean the lifting of a lockdown or an all or nothing. It means that adjustment isn't done as carefully and controlled as possible. And given that we don't have full vaccination, it will spread.
So while you may be rejoicing at the relaxed restrictions and the lowering number of COVID-19 cases in your state or city, do not let your guard down. Mask up, practice hand hygiene, and maintain physical distancing. The pandemic is not yet over. Get your vaccine when you can. This is Geetika Mantri for the News Minute.